Hi, everyone. This is Dr. Lauren Kaufman welcoming you to the Neurocritical Care Society podcast. You've tuned in to another episode in our Perspective series, where we explore diverse perspectives in neurocritical care. Today, I'd like to welcome Dr. Yasser Abulhasan. He is a neurointensivist that practices in Kuwait University and holds multiple leadership chair positions representing the Middle East and North Africa, and is liaison serving on the board of directors for the Neurocritical Care Society as well. So welcome to our podcast today.
Thanks, and thank you for hosting me, Lauren.
Before we get a little bit into how you became involved in representing your region, would you mind just telling us a little bit about your background?
Yes, so I did my medical training in University of Aberdeen, the UK, and after that, I decided on starting an anesthesiology residency at McGill University. This was followed by a neuroanesthesia fellowship. And while doing that, I remember at that point, my mentor, who is Dr. Mark Angle, said, you know what, just go and spend a month in the neuro ICU. That concept of a neuro ICU wasn't really developed in either the UK and very limited spots within Canada itself. And I said, you know what, okay, let me go, let me start that. And since then, after doing a few probably a week of time as a fellow in the neuro ICU, said, you know what, I'm gonna go ahead and do a fellowship in that too. I applied, got in, and that was, and I completed that training in 2011. And since then, I've been hooked to the specialty itself. I've been ambitious towards it. I've had all the passions that were associated with someone who loves the job that they do. And I actually, for that same year in 2011, the Neurocritical Society hosted its meeting in Montreal, which I attended. And that was the second hook that kept me going with the Neurocritical Society until today.
Awesome. And you mentioned, that certain regional parts didn't have neurocritical care well represented. After you finished your training, were you one of the first people to practice neurocritical care in Kuwait?
So in Kuwait, in Ibn Sina Hospital, where I actually do my clinical practice, there was a setup of a seven-bedded ICU, which mainly catered to patients with complex neurocritical care issues. That was incepted in around 1983. It was never run by a neurointensivist. So in 2011, when I went back to Kuwait, I was the first neurocritical care trained neurointensivist that ran that unit, and I've been a director of that unit since 2012.
Wow, that's really impressive. I'm sure you've seen it grow a lot since that time. And, I was able to join you in one of the conferences in your region recently, the Emirates Critical Care Conference. And before we get into how NCS became involved with that conference, could you just tell a little bit to our listeners about what the Emirates Critical Care Conference is?
Yes, so the American Critical Care Conference is a critical care conference, as per the name says. This year that you joined us, Lauren, at was the 19th edition. So next year is a big celebration where we're going to celebrate the 20th edition. It started off with a single tract 19 years ago. It grew with time. It encompasses attendees and speakers from over 35, 40 countries each time. The neurocritical care tract itself was initially introduced, if I recall correctly, around 15 years ago. And then the NCS became more involved, especially with the Global Partnership Initiative in 2011, and the first regional meeting within the region took place in 2019, and this year was our fourth regional meeting, which was in partnership with the International Pan-Arab Critical Care Medical Societies and the Emirate Critical Care Conference.
That's great. And I mean, it seemed like there was a really good turnout. Do you have a rough idea of how many people participated in the Neurocritical Care Society tract of that conference this year?
Exact numbers I don't have, but what I was told is in the conference itself, registration was over 2,200 this year, which is one of the bigger numbers, especially coming out of the pandemic itself. In previous years, registration's always been around 1,600 for the entire conference. However, we should be aware that there is multiple tracks. So there was, I think, around 9 or 10 tracks this year. So attendees had the chance to attend various parts of the conference. It was a 3-day track. So day one was ENLS, day two was the neurocritical care tract itself. There were poster presentations on that day that were submitted for the neurocritical care part of the conference. And there was awards that were given out on the last day. And what was interesting this year is we actually conducted 3 workshops focusing on brain death determination, which is it's a nice partnership between the NCS with the Ministry of Health and Prevention at the UAE and the Emirate Critical Care conference itself. And that was on day 3 of the conference, which was a 3-day conference, but it also spanned in the following 2 days after the conference. So within a conference itself, and then followed up by 2 extra days post-conference.
That's great. And I think day one was the ENLS course. Is that right?
That is correct.
And how was that received? I assume it's been happening for a few years now.
Yes, you're right. So it was first introduced as part of ECC in 2016. I think we missed 2017 as having an ELS, but from 2018 onwards, there has always been an in-person ELS apart from during the pandemic year where that couldn't have materialized. What was interesting is in 2021, there was recognition from the Neurocritical Care Society as the Emirate Critical Care Conference hosted the World Federation of Critical Care Nurses as part of that conference, and actually offered as waived fees 100 ENLS registration participants who wanted to attend it at that point. And that was extremely well received last year. It was overbooked. This year, from what I understand, is there was around over 60 attendees that were part of ENLS this year.
Wow, I wonder if part of that draw was just the huge names that you had in the speaker lineup. I mean, I was so impressed to see, several former Neurocritical Care Society presidents, very prominent speakers. How did you develop the curriculum for the Neurocritical Care Society tract for the day's worth of speakers?
I should always recognize that this is a huge partnership between, and actually not just huge, it's actually a very strong partnership between the NCS Society and leadership within ECC and the International Panel of Critical Care Medicine Society. And this is, as I mentioned, started more than 15 years. This is the 4th edition. And what I've actually realized is people from the society and from the region who are involved within the care of neurocritical care patients want to get involved. They want to be part of education. They want to be part of collaboration. They want to be part of expanding synergies, and they want to come and spread that word of the society, the missions and visions within a region that, to be honest, doesn't have a lot of established neurocritical care units. They're developing. There is a few around there. However, the passion that is seen from both sides, the bilateral efforts, has developed over the years. And as you saw, there is a lot of big names from our world of neurocritical care that were there this year in attendance.
And, I thought it was a nice mix of topics, of things that were probably more relevant to the general intensivist and things that I was very interested to hear as someone that practices neurocritical care. What kind of topics do you foresee being held in the future? Do you think you'll kind of keep that mix?
In the past few years, the program itself was developed both from the ECC, and I also want to always recognize the co-chairs of developing that program, both Dr. Kathy Wartenberg and Dr. Tamar Abdulhaq, and we've always developed the ideology, the topic selection, and so on. And we also discussed this during annual meetings of the Neurocritical Society with leadership from the society itself. We've gone through the various topics themselves. We've gone through the selection of speakers around the annual meeting. There was back and forth discussion throughout, and that's how things got developed. From a topic point of view, as the crowd that attends the Emirate Critical Care Conference are more or less general intensivists, so we wanted to keep it within the broad realm of day-to-day practice. What we concentrated on this year is not just the management, but we looked at practical issues such as prevention of delirium, dysphagia, and how it's diagnosed, cerebrovascular disease with the various entities and the statistics that has been presented in the literature of recent years. We had pro and con debates, which is always a favorite at the society and has always been an important section of the neurocritical care tract. But in addition to that, as part of an hour in the afternoon, we really dedicated that to determination of brain death within not just the American Academy of Neurology update and the potential update, which is going to come soon, but also at what's happening in ground within the UAE, both from an adult point of view and also from a pediatric point of view. So as you can see, the realm of the topics are diverse. They're intended for general critical care physicians. However, they are delivered by people that do practice either within the various countries around the world and people that practice within the region, Middle East and Africa region too.
Mm-hmm. Yeah, as you mentioned, the afternoon spent on determining death by neurologic criteria was super interesting, and we'll talk more about that on a future podcast with Dr. Dabu, who's been leading that effort in the region. As you mentioned, I was able to attend. I was super fortunate to be able to join the conference for my first time, and I hope to be there in future conferences. Who do you think are target audience members, or who would you say should consider coming next year or future meetings?
So anyone who's interested in neurocritical care is more than welcome to attend. Attendees from not just the region, but from international general critical care physicians, neurointensivists from any part of the world are more than welcome to attend. Flying to the region is extremely easy. There is always access to airport system. There's there's a lot of direct flights from everywhere from the world. Getting into the country is not demanding from a visa requirements or so on. Dubai is tourist friendly. It's medical experts friendly. It encourages attendees to be there to fulfill their expectation from either education, from research, and from collaboration efforts. So everyone's more than welcome to be a part of the track next year.
Yeah, just as a note, a practical note for those listening, I was very surprised to see how reasonably low the registration rate was for other conferences that I typically attend. So I would recommend people to definitely check it out and to consider it in the future. Last question I have for you is, what is your vision for the Neurocritical Care Society tract the next few years as this partnership continues with the Emirates Critical Care Conference?
It should only grow. Hopefully, we're going to have more research-focused sessions. Having research projects from the region has been scarce so far. I've been trying to advocate for collaboration from the various international projects that are taking place to recruit members and healthcare providers from our region. A nice way to actually foresee this in the future is to get people involved in the Curing Coma campaign as part of the ongoing project. In addition to ongoing trials that can include various nations from from our region, especially knowing that diversity of care does exist, and self-fulfilling prophecies are extremely minimal in our region just because of the nature of the care that we give. So we have a unique patient population and unique way of comparing what is established out there in the literature, and we can provide to our ongoing neurocritical care literature per se.
Great, thank you. If people are interested in some of these international collaborations, as you mentioned, we'll refer people to the Curing Coma campaign website, which they can get to through the Neurocritical Care Society. Are there any other routes or avenues or people that you think they could reach out to if they are interested in participating or collaborating with some of our international colleagues?
For sure, as you mentioned, one of the best ways to actually sign up is through the NCS website. Send us an email at ECC. Just make sure that you let us know that you're interested and you want to be involved within the programs for the next few years.
Great. Thank you so much for joining us today. We really appreciate you taking some time to talk about this, and have a great day, everyone. Thank you.